Hello out there in the virtual world. Welcome to Graham This Week. My name is Jordan Person, and I am our staff nurse and one of our columnists for Grassroots America magazine. Due to COVID and our inability to pass our magazines around the way that we have been, we've begun a new journey, a virtual journey, where we are bringing the magazine to life. We are featuring scientists and researchers and activists and advocates and everyone that makes our magazine what it is. Today I have with me the amazing Dr. Jacob Miguel Vigil. He is an associate professor of psychology at the University of New Mexico. Thank you for joining us today, Dr. Vigil.
Thank you for inviting me.
Absolutely. I apologize if I messed up on your introduction there. So let's start out with who you are. Tell us a little bit about yourself. The reason we are so obsessed with you is because you are one of the many scientists that is working with Relief app. And that is one of our sponsors. And we will get more into what exactly Relief is. But first, we want to know about you. So can you tell us what you are currently doing for the University of New Mexico?
Sure. So I've told my story several times, but I actually waited until I got tenure as a conventional scientist to be able to focus full time on cannabis research. So at that time, about 5 years ago, I just looked around and I didn't see a lot of the work I was doing really amounting to improving the world around me. And, you know, when I looked at other people's works, it looks as though the same was true for them as well. So I really wanted to focus directly on the well-being of my community. And I just got tired of seeing all the suffering, what I call secondary victimization. So those are not only the ineffectiveness of conventional pharmaceutical medications, but oftentimes the side effects that are carried over from the use of those medications. And I do know that cannabis has been so effective in helping so many different people that I wanted to essentially prove it to the world. And I have essentially been conducting medical cannabis research full-time for about 5 years. We have a full team of researchers around the country as well as in the University of New Mexico. And we are targeting many different types of patient conditions as well as fundamental aspects of cannabis use. So for example, how does tolerance work? What are the chemovars involved in their association with different types of effects, including side effects? And ultimately, how best we can individualize cannabis therapy.
That's pretty incredible. Thank you for advancing the research and the science of this plant. It is overdue and so very necessary for so many different groups of individuals to believe the power of this plant. So many people, self-included, science is everything. And when we have the proof, it allows us to teach that many more people. So thank you so much for the work that you're doing. I saw in researching you that in 2016, you started the Medical Cannabis Research Fund. Can you tell us what exactly that is?
Sure. So that was actually the result of many years of failed efforts trying to procure federal funding for basic research, elucidating not only any potential medicinal benefits, but also just the basic risks of cannabis use. So as everybody knows, much of this basic work has been prohibited for a really long time. So with the inability to conduct this type of work through federal funding, I decided to create a mechanism whereby the general public and private donors could essentially support the type of research that they feel may most benefit their own individual lives. So I created a mechanism essentially for individuals to donate to the type of work that they think needs to be done. And through those efforts, essentially what we're able to do is pay for the logistics of different types of studies, so participant payments, pencils, things like that, as well as provide scholarships to graduate students. And we've been doing so for several years. So it's tough. I don't know of any other scholar in my career that has created a mechanism whereby the general public can fund basic public health research. But I felt that somebody needed to do it because it needs to be done. And I just feel very blessed to have the opportunity to help people.
That's fantastic. What is the information for your fund so that if people listening want to make a donation or want to share the information, how can they do so?
That would be great. Just visit mcrf.unm.edu. So it's the Medical Cannabis Research Fund, through the University of New Mexico. And we would greatly appreciate any donations, big or small. They're all put to very good use. And over the past several years, we probably produced over a dozen different studies. So, you don't need $1 million to do something that's really important. But, there's so much work that needs to be done out there. So the more that we could collectively kind of, send our energy in these good directions, the better off we'll all be.
Absolutely. The research is what I can't say we're lacking. When I teach cannabis massage to my students, I always use the example of PubMed, and I type in the word acetaminophen and show them how many studies have been done. And then I type in the word cannabis. And there's more studies that have been done on cannabinoids than there has been on the most commonly prescribed over the counter or recommended, medication that people take around the world. So it's amazing to me to continue to get this research out there. I noticed that you also have a YouTube channel of your own, the Cannabis Connection University. Can you tell me why you started that and why you continue to add to it?
Sure. Well, my students convinced me that this would be a great idea for a couple purposes. One, to just reach out and just try to reach more donors, and also let people know what we're doing here in New Mexico. A lot of people don't know that we're trying to pioneer some really important work, as well as to basically educate the public. So most folks don't have access to primary literature showing actual data. You usually have to have an institutional license or be affiliated with a university and so forth. So I think it's really important that I can directly talk to those patients that have specific types of questions, and I could give them straight answers, not only from my work, but objectively looking at the scholarship around me. And I think a lot of us really need some kind of guidance. So medical providers as well are really at a lack of scientific and medical information for how best to not only authorize, but to suggest different types of cannabis products or dosage strategies or whatever. So there's just a tremendous need for medical cannabis education out there at all levels. So that's what we're trying to do, is just reach out and give people information.
That's fantastic. And so if people want to subscribe to your YouTube channel, will they just type in Cannabis Connection University into YouTube?
Cannabis Connection University at YouTube. Yeah, that's the name that my students came up with. And we actually started this before COVID. So obviously there's been some disruptions, and, we're just kind of kicking it along for now, but it's going to start up in a bigger way. And we have many plans for the channel in and of itself. So the basic idea is to provide people not only a voice, but to inspire individuals to feel confident in making their own medical decisions, and to feel confident in essentially advocating for their own well-being, sometimes even irrespective of authority figures such as our doctors, where there might be a dissonance between what we're prescribed and how we're reacting to those suggestions, sometimes in ways that we might be a little bit inhibited or afraid to, vocalize to our prescribers.
Absolutely. I fractured my shoulder, and after the surgery happened, I refused all the opiates. And I called to complain about pain. And he said, Jordan, you're refusing the medication that I can give you. You keep telling me all you want to use is cannabis. And so when I went in for my follow-up, it actually said on my chart, patient prefers plant medicine over pharmaceuticals, don't bother mentioning. I was like, well, it's true. But when I talked about topicals, he was like, don't talk so loud. I can't have everyone hearing what you're saying. And I'm like, but you can. You're choosing to not bring cannabis into your practice. And I understand it. There's federal funding. There's a million reasons why. But thank you for educating physicians and nurses and all of the medical professionals that are out there. We need concise medical cannabis information, the same information going to people time and time again, not people surfing the internet and finding one CBD site saying that their product is the best, and the patient doesn't realize that they're just trying to sell you that one product. And so thank you for putting that information into the universe. We desperately need it. And speaking of putting information into the universe, can you tell me a little bit about Relief app and the work that you're doing with them?
Sure. So we actually partnered with the developers of the Relief app. Maybe, man, it's been a while. So maybe about almost 4 years ago. And that came about essentially from, again, our inability to obtain federal funding, essentially to build a very similar type of application. So that particular study wanted to compare the effects of opiates against cannabis for treating pain in real time. You mentioned that there's a lack of studies out there on some of the most prescribed medications, probably by design. You're not going to find any studies that are directly comparing the efficacy of cannabis against a conventional medication in the same study, because probably nobody wants to see the results of that, or at least people that have conflicts of interest, right? So we essentially we're trying to build this app to measure real-time feedback and assessments of symptom intensity changes. And my colleague came across the Relief developers who essentially built this app for us, not for us, but essentially in a really ideal way for collecting this information. And to date, I believe it is the largest data set of real-time cannabis usage sessions in the United States. In fact, we have over, I believe, 250,000 at this point user sessions. So this is just a tremendous data set. It's really again a blessing to be able to have access to such information. But with that, we're able to aggregate many different characteristics of the cannabis products that people are utilizing and essentially throw them in these massive regressions. So we're able to pit, for example, cannabinoids against each other or routes of administration against each other, and eventually look at those interactions, which I believe will be a faster route of obtaining unknown information, such as what are the interactions that are most effective for treating A, B, or C, as opposed to a clinical trial approach, which will take a long time. So if you have one clinical trial where you're testing variable A against variable B, now you have to test variable A against C, A against D, B against D, and so forth. And you can see all the possible interactions. So I think that this observational research design is really most appropriate for getting at the types of questions that we're really seeking to address. So what are the best ways that we could individualize cannabis therapy as well as minimize the potential risks of use?
Wow, that's absolutely incredible. So is the Relief app something that is available to the general public that can just go to an app store and download it?
They can, yes. And essentially what folks do is they enter the product characteristics as well as any kind of demographic information. It's all anonymized, obviously, when it gets on our end. But essentially what you could do is you get to obtain real-time feedback on the products that you're using. And this is so important because using cannabis requires trial and error. It's impossible to obtain the same exact product twice, even within a batch, even among clones. You're going to get features that are different in the cannabis expression. So it's really important to get this kind of feedback to know, well, this kind of helped a little bit more, or this one made me feel a little bit foggy, and so forth. And to be able to keep track of that electronically, I think is a really convenient way to do so. And then likewise, I've also gotten feedback through some of my studies that use the Relief app that they really appreciate essentially kind of getting this real-time assessment of their health decisions. So there's such little areas in life where we have a sense of control over what we're doing with our day. Oftentimes we have a schedule, and we're under different types of burden, but if you could actually assess the decisions that we're making and then kind of pivot or adjust accordingly, I think that that gives people a sense of empowerment. And I think that people really appreciate being able to get feedback on their basic health. So it can accommodate, I don't know, maybe 60 or so different health conditions, or maybe even more at this point. I think they're building in sub-conditions, so there might be hundreds at this point. But it's convenient to get that kind of feedback day to day. And then likewise, it provides you little graphs on how you're doing and so forth. So yeah, I encourage folks to check it out.
This has been so incredibly informative today. I can't thank you enough for your time. I do have one more question for you before we hop off. What are your future plans, Dr. Vigil?
Wow. Well, ultimately, I just want to help improve the world. That's really what I'm trying to do. But in terms of different types of studies, there's just so much out there that needs to be done. So essentially, we're trying to put together a big puzzle, and we don't even know what pieces are involved or the shapes of the pieces. So there's just a lot of unknowns out there. I do feel incredibly grateful to be able to work here. I do oftentimes describe cannabis as an existential threat to the pharmaceutical industry, just not only based on anecdotes and stories from hundreds of patients at this point, but just from my own data. There's no other medication that has such a wide window of therapeutic potential and is so fast acting relative to many conventional classes of medications, as well as offering a safety profile that is unmatched in comparison to many classes of conventional medications. A lot of folks don't know out there, but medical errors from conventional medical applications are the third leading cause of deaths in the United States. So there's much to improve. And this area, I think, will ultimately be guided towards more individualized medication. And what that requires is a better understanding not only of the phytochemicals that compose the plant itself, but also the changes that we experience not only cyclically across seasons, across different types of relationship stages, but also diurnally across the day. So we're an incredibly complicated being that is interacting with these phytochemicals in ways that are quite dynamic. There needs to also be much more research focused on females. Females are incredibly precious, obviously, and you have your own specialized biological systems that we don't know a whole lot about in terms of kind of their functions and sometimes the origins of some of the discomfort and so forth. So there needs to be a lot more focus on females as well as all the different types of patient conditions. So, I always come across new patients that are, almost begging me to do research in a particular area, and I put it on the list. And as long as God keeps me alive, I'm going to do my best to complete it.
That's fantastic. Thank you for dedicating your life to the advancement of this plant. Thank you for the research that you're doing. Just thank you for your time today. This has been incredibly informative. I've learned a lot about what you do, and I hope everyone out there has too. Stay tuned. We're going to do another episode with Dr. Vigil with Sarah Moss. She is going to go in depth with one of the amazing studies that he has done for the Relief app. So thank you so much for being here today. Thank you for listening. We hope you learned something, and we'll see you soon.